Well, good morning and welcome into another session with Allison Schwartz from Medica Pharmacy for Your Health, our program. And it's not a session, it's a learning opportunity. And today, I guess we can say that this is not just for the women, but it tends to be a women issue when you talk about fertility, but it involves family.
It does.
Yeah.
It does. And actually, when you really get into the details of why people have fertility issues and problems maintaining pregnancy, and even, birth defects and, chromosomal abnormalities that can cause some defects, it can have to do with the males too. So it is important to address both sides of it. So
When we hear people, I have two daughters right now, daughters-in-law and stepdaughter that are both with child right now, expecting in the next time, and they worry about, as they very well should, their diet and everything. But should a lady that's planning to have a child in the future sometime be thinking about that now?
absolutely. Not only is diet important, but it's important for people to understand that a large amount of pregnancies are not planned, or you get pregnant. Maybe you're kind of thinking about planning it, but you end up pregnant well before you really meant to be pregnant. And the average newborn baby is born with 235 chemicals in their bloodstream. So, something that's so innocent and so pure and should be sterile is loaded with chemicals in their system. And, so you have to think that they're getting those from the mother and possibly, the father in conception, and you have to kind of to target that. So it's important for people that think they're going to think about this to be on some good vitamins, and if you're really serious or having trouble, maybe doing some detoxing. But it is important, and especially when it comes to, there's lots of prescription drugs, and a lot of them say, well, they're probably safe, maybe they're safe, take them if the benefit of taking them outweighs the risk to the fetus. We don't really study drugs in pregnant women, and so I always just think the least amount of stuff that you can take while you're pregnant, the better, and the healthier you can eat, because if you're going to eat bad food, you're going to end up gaining more weight than you should, and you're going to end up with high blood pressure, potentially gestational diabetes, which if you're a gestational diabetic, it actually doubles to triples your risk of becoming diabetic in your lifetime. So it is important to watch the foods that you're putting in your body.
Well, I see you've done a lot of research, so I'm going to let you just take off a little bit on it, what we need to cover today.
All right. Yeah, we have a lot of questions, and we see a lot of women that come in the pharmacy that have either trying to conceive and have for a while unsuccessfully. I personally know of 3 women very recently that have had multiple miscarriages, and nobody can really figure out why that they're having these miscarriages. And you got really young women that are having to go to in vitro fertilization. They're young, their husbands are young, they can't get pregnant. And you got to kind of wonder why that is. Now, there's lots of things hormonally, and I've talked about hormones before. So you got to look at the hormone balance. We're overloaded with estrogens in the environment from the foods that we eat, unless you're eating organic, and I know we've talked about it. But you get a lot of growth hormones and estrogens and steroid hormones, antibiotics, lots of things in some of our food products. That imbalance of hormones can affect if you ovulate. Do you ovulate normally? Do you have a short ovulation spell? Does your progesterone level peak at the right time? Does it stay high enough to maintain a pregnancy? Because when you produce that egg, when you ovulate, you produce progesterone. And, they joke about how the older you get, you're more likely to have twins if you get pregnant. Well, because progesterone tells the sensors of your brain to not release another egg. So if you don't have enough progesterone, then maybe another egg's going to get released so you could have twins. But unfortunately, sometimes you don't even get that twin state. You get to where your progesterone level is not high enough to build the endometrial tissue to support the fetus if the egg gets fertilized. So, do you have the right levels of estrogen to ovulate, and do you have the right levels of progesterone to maintain it? So that's something to look at. And, a lot of people think that's really tough to test, especially if you're having trouble conceiving. That's one of those tests we can do at Medica with a saliva test. It's $200, but it's a lot cheaper than, doing the in vitro and doing all these fertilization drugs. So you spend $200 to figure out, is it me? Is my estrogen level wrong? Is my progesterone level wrong? What's going on? And it'll help pinpoint, this is the time of your month when you ovulate. So it actually gives you kind of a guidance on your hormones level right, and when is the best time for me to get pregnant. So it can be a tool to help you get pregnant if that happens. Thyroid hormone can also interrupt pregnancy. So if your thyroid hormone is a little bit too low, you may have trouble maintaining that pregnancy. So that can interplay. The other thing, if you do get pregnant, is, like I said, we mentioned all the chemicals. We know that autism is on the rise, and ADD is on the rise, and Asperger's, and children with allergies and asthma. And we have all these things going in. Well, we always worry about the mom and, giving that mom that really good prenatal vitamin. But what we're starting to see is that men are deficient in their nutrients too. And folic acid, B6, B12 are very specific to help prevent birth defects. Calcium and magnesium are really important for the growth of the fetus. And if the man is deficient in folic acid, they're showing increases in those chromosomal abnormalities. So you're looking at higher risks of Down syndrome and the autism and other, not only like physical birth defects, but mental birth defects as well. So not only does that woman need to be on a really good prenatal vitamin, but the man needs to be on a good vitamin as well. And as I've said before, not all vitamins are created equal. And a lot of people come in and say, I can't take a vitamin. Really upsets my stomach. You're probably not on the right vitamin. You're on one that's probably coated in wax and packed so much that it sits in your stomach and irritates instead of actually dissolving and being absorbed. So if you think you can't take vitamins, definitely come talk to us. We have a few that if you don't like and they don't work, you can bring back. So definitely need to be on that prenatal vitamin. The importance of the calcium and magnesium is obviously you need calcium for proper bone growth. But magnesium, you see so many women these days, they get the big swollen ankles, their blood pressure goes up, they get preeclamptic, and they can't go full term. Magnesium actually is pretty deficient in pregnancy, and a lot of pregnant women will tell you they get constipated. Well, magnesium is the world's greatest stool softener. So you add some magnesium, very safe. It's just a mineral that you need anyway. Helps to normalize your blood pressure, to stop the swelling, to help with those muscle cramps you get late in pregnancy. Helps with that constipation, but hopefully will help you to not get the preeclampsia and go into early labor or have to get induced. I mean, you talk to women, they get induced, and some of them are in labor forever. And a lot of them end up in a C-section, and they didn't want that way. So if you can carry that baby full term and, no swelling in your ankles, no blood pressure issues, and you have that baby the way it's supposed to come, everybody's going to benefit from that. And I know that it's just, I very fortunately don't know from experience, but unfortunately have a couple of good friends that just heartbreaking to see them try to get pregnant, to have miscarriage after miscarriage after miscarriage. And if you can, take some good supplements to help you make sure your baby is healthy, detoxify your body to make sure that you are trying to get rid of those chemicals in the bloodstream and balance those hormones, that you can have a healthy full-term pregnancy and a healthy, happy baby and mom and dad at the end of it. I mean, it's just, it means a lot. And if we can help do that, we would love to do that.
It's always important to stay healthy, but as you've said just now, that getting yourself ready to have a baby and take care of that baby afterwards is very important. So.
It is. I mean, we all think about it. You find out you're pregnant and you're like, oh my goodness, I need to eat better, I need to exercise. Yeah. But the vast majority of abnormalities are going to start before you know you're pregnant. Yeah. And so that's why it's so important to be on that good probiotic. We do have some detoxifications. A lot of the toxins, pesticides, and chemicals that you get out of the food supply, they're stored in your fat tissue. And the only way for you to really excrete them is either by losing lots of weight really fast, or when you breastfeed, you tend to shed those toxins out of your fat cells. But they're also going to your breast milk. Yep. So ideally, you'd like to kind of cleanse yourself of that first. And so, a lot of times we'll recommend that both husband and wife, or boyfriend, girlfriend, however you want, if you're not married, we don't have a problem with that. You just need to detoxify. So we have something called detoxification factors. I will warn people that it does not smell good. I mean, it has got some extracts to really help bind up toxins out of your liver and out of your fat tissues to get rid of them. But because of the herbals in it, it smells bad. So you want to make sure you take it with a big glass of water, because you don't want to burp it up later. I'm pretty sure. I mean, I put a friend of mine on it just because they wanted to kind of detox and try to lose the last couple of pounds. And I was informed that it is not a very nice smelling pill. So, but it's been shown to do some really good things. And then anytime you detox, you got to make sure you have the right bacteria in your digestive tract, which we've talked about. Because if you're going to take a vitamin, you need to be able to absorb it properly. So you always recommend the probiotics. Plus, if you're going to have a vaginal delivery, the baby gets healthy bacteria for their body by coming out the vaginal wall. So it's important to make sure that the mom takes a good probiotic to make sure she has really good intestinal flora and vaginal flora so that the baby will benefit. So you'll see less infections, less ear infections, less colds, and less reflux when that baby has really good bacterial flora.
So if you're thinking about expanding the family, act now before you start the process.
That's right. Plan early and be ready so that you're ultimately as healthy as you can be for that healthy baby and hopefully a successful, good, long pregnancy.